Good evening and welcome to Doctors on Call, where your health is your wealth. I'm Chrissy McLarty. Sinuses. Almost everyone complains about them. Headaches, congestion, allergies, but are sinuses always the culprit? Tonight we have Dr. Andrew Marlowe and the Center for Hearing to answer all of your questions. He's been practicing for more than 25 years. Dr. Marlowe was dual fellowship trained and has spent the last 16 years in Sarasota. Welcome to the show, Dr. Marlowe.
Thank you, Chrissy.
Well, we're very happy to have you. So to kick off the show, can you just tell us a little bit about yourself?
Sure. I'm an otolaryngologist, which most people understand as an ear, nose, and throat physician. As you said, I've lived in Sarasota for 16 years, and it's the best move my family and I have ever made. I have a private practice here in Sarasota, and we do general otolaryngology, which means I take care of kids and adults and ear problems, sinus problems, throat problems.
Okay, great. And you called it, what is it?
Otolaryngology.
Otolaryngology.
Yes.
So what does this mean? What is that?
Technically, it translates, it's Latin, and it translates oto, meaning ear,
Okay.
and larynx, meaning throat. And it used to actually be otorhinolaryngology, so it was actually ear, nose, and throat. And they shortened it because people have trouble remembering it and pronouncing it. But it basically deals with medicine and surgery of the head and neck region. So pretty much anything kind of from here up. Thyroid problems, voice problems, special senses of smell, balance, hearing, taste, all of those things
All the
are
important
encompassed.
stuff, really.
Well, I feel that way, but I'm a little biased.
Okay, great. So if you would like to call in right now, the number is 941-361-4675. So we'd love to hear from you right now. Any questions you may have, 941-361-4675. But for now, we're just going to continue this conversation. Why are you here? Why did you come on the show today? Why is this your passion?
Absolutely. I think the reason that I came on, at least today, to talk about sinus issues is because it's one of the more frustrating things that patients deal with, and as a professional, one of the more frustrating things that I have to deal with on a daily basis, in the sense that people use the term sinus very loosely and very generically, and it means a lot of different things depending on who you're talking to at any one time. And one of the arts of my specialty is to try to figure out when someone says to me they're having sinus problems, what exactly are they really talking about?
Right.
Because a lot of things overlap and a lot of things share symptoms. And
a lot of masking, if you will.
Yeah.
I think we might have someone on the phone right now with a question for us. Todd, can you hear us? Todd, are you there?
Yes, I can hear you.
Okay, great. What's your question for Dr. Marlowe?
Well, I was given advice from my doctor in the past. I have sniffling allergies, and it would cause me to not be able to hear. I felt like my hearing was dampened, and he recommended that I pop my ears by holding my nose and blowing. And I was wondering if I was doing any damage to my ears that way.
Great question, Dr. Marlowe.
That's a good question. Well, the first question is, why do your ears feel clogged? There's multiple potential reasons for an ear to feel clogged. And the one that we always think of is what we call eustachian tube problems, meaning that we have a tube that runs from the back of our throat up to the inside of our eardrum. And so if that tube is clogged or congested, your ear will feel and sound congested. And so the things that affect that tube would be things like allergies, sinus problems, acid reflux, etc. But there are other things that can cause the ear to feel clogged, and it's sometimes difficult to differentiate the two as the patient. And so again, it's my job to try and figure out the difference. So there's a condition we call referred ear symptoms, meaning that your ear can feel clogged and your ear can actually be 100% entirely normal, and yet it feels clogged. And so again, we have this diagnostic dilemma. How do I differentiate between these things? And part of it is the history, what the patient may tell me. And part of it is how they respond to treatment. So if he's been treated before for, let's say, allergies and he didn't get better, that means maybe this isn't allergies. And lastly, we have some tests to help us differentiate. So again, it comes down to get the right diagnosis.
Is the most important thing, really.
Absolutely, it all stems from that.
Great question. Thank you so much for joining us tonight. And again, if you want to call, our number is 941-361-4675. So when you were talking about some of the different things, we have some great visuals here. Why don't you
Absolutely.
show us
Well,
a little bit of what we need to know about sinuses?
Okay. So we'll start with this one here.
This looks like a
This
good
is
one.
kind of a slice of the center of your head. You can see the tip of the nose here. The brain would be sitting up here, and the eyes would be on either side here. And we have 8 sinuses in our head. We've got 2 in the forehead. We've got 2 between the eyes. We've got 2 here in the cheeks. And then we've also got a set back here towards the back here, called the sphenoid sinuses. And so it's possible to have sinus disease that involves a single sinus or sinus disease that involve multiple sinuses. And that helps us, knowing how many sinuses are involved helps us to determine what kind of treatment we need.
Okay, so call me crazy, but why are sinuses important? Why do we need these things?
That's a really good question. That's a really good question. We don't know for sure because we didn't actually make the system, but the theories are twofold. One is that sinuses are a good way to have your head be as large as it needs to be to contain a human's large brain, plus all your organs of hearing, balance, breathing apparatus, eating apparatus. All that has to be contained within the head, right?
Wow, that's a lot going on.
If your head was solid bone, it would weigh double what it weighs. So sinuses are a way to have the head be lighter.
Okay.
Because they're air cavities. They're really nothing more than air cavities. We make them into this big thing, but they're really air pockets in your head.
So when you say we make them into this big thing, I think this is a question that I'm not alone. Sometimes you get a cold or you get allergies or something, and you automatically go to, oh, everything up here, it's congested. I have sinus problems. I might have a sinus disease.
Right.
Is that right?
Well, it's almost a joke in my office because we hear it all the time. People come and say, I got sinus. I got sinus. And
I have sinus.
Exactly. And what that means is a different thing for everybody. Some people that means they're experiencing headaches.
Okay.
Some people that means they're experiencing postnasal drainage. Some people that means they're having trouble breathing through their nose.
Right.
So my office staff almost sees my eyes roll back in my head when someone says I got sinus. But the first questions are, let me try and tease out what thing are we actually dealing with, because so many things overlap. And you have to try and tease it out and figure out which thing am I actually dealing with here.
Okay, great. And so how do sinus problems affect, we have some other models here. We have the nose and the head, but then we have a throat and an ear back here. Are these, I feel like since you knew we were going to be talking about sinuses, you brought these for a good reason.
I brought all my best toys.
Okay, so let's bring these up front and center and see what else is affected.
So this is kind of a model of the throat. And so you can see kind of the jaw and the tongue and the voice box here.
Okay.
And the idea here is that one of the things that most people attribute to sinus is a condition we call postnasal drainage.
Okay.
Now, in my mind, postnasal drainage is not a disease. It's a symptom. So if you come in and you tell me you feel like there's things in your throat, there's something draining down, that's postnasal drainage.
Okay.
So then the next question is, why do you have postnasal drainage? There's many potential underlying causes.
And let me guess, most people think allergies. Is that right?
Most people think allergies,
Okay.
absolutely. And why? Because there's so many things available to treat allergies. You've got all kinds of over-the-counter medicine. So everybody thinks this is going to be allergies.
Sorry about that. That's for later.
And so yes, everybody automatically assumes it's allergies. But one of my clues, one of the things I always ask patients when they're sitting in my office is, well, what have you tried so far? Because most people have tried something. And most commonly people say, well, I tried this and I tried that and I didn't, and what was the response? Well, I didn't really get better. So then I tried the next one and it just happens to be brand C or brand D of the same kind of medicine.
Right.
If you look at the over-the-counter medicines, there might be 4 or 5 medicines, and they're all just mixed in different ways and different colors, and some are liquid, and some are capsules, and some are... It's the same medicine.
Oh my goodness. So might not always be the right thing.
Well, it might be the right thing, but if you've tried some and they're not working, then what I encourage people to think is maybe I'm not treating the right diagnosis.
Right.
So don't just keep treating the same thing over and over with the same group of medicines. Either the medicine wasn't effective for the correct diagnosis, or you have the wrong diagnosis.
Okay, well, we have lots more coming up, lots of exciting things ahead for local doctors on call. And do you know what an endoscopy is if you're watching? Well, if you don't, you're about to see one done live right here on SNN. And then Shotzi, the allergy dog, is joining us. So lots of good things to look forward to. We'll be right back. Welcome back to Local Doctors on Call. I'm Chrissy McLarty. Our guest tonight is Dr. Andrew Marlowe of Sarasota Center for Hearing. We're talking about sinuses, and joining us now is Dr. Marlowe's beautiful wife, Jean. Hi, Jean.
Hi, Chrissy.
How are you?
Good. Thank
We're
you for
happy
having
to
us.
have you. Oh, yes, of course.
Thank you.
So before we get into this endoscopy procedure that you're all about to witness live on SNN, we have Susan on the phone. Susan, can you hear me?
Yes.
Okay, great. What's your question for Dr. Marlowe?
Well, I've had some problems with frequent sinus infections, and I've noticed that my hearing, I lose my hearing a little bit when that happens.
Okay.
So if I understand the question correctly, you lose some hearing when you have sinus infections.
Yes.
And is your
Okay.
question, is that normal for that to happen?
Well,
Right.
as you know, they're linked. We talked before a little bit about the eustachian tube and how that runs from the back of the throat to the ears. And so if you truly have a sinus infection, that causes congestion in the whole area, both the back of the nose and the back of the throat, which is linked to the ear. So yes, it can lead to ear congestion. We see this frequently in children when they get sick, they get a cold or a sinus infection, they end up with an ear infection. It's less common in adults, but it's absolutely possible, and they absolutely can be linked.
Great question, Susan. So that really just brings back the fact that your sinuses are connected to not only the nose, the ears, the throat. It's all
That's right.
all kind of one, and that's why they call it ear, nose, and throat, right?
That's right.
There it is. Okay, great. Thanks for the question, Susan. And if you have a question, feel free to call us 941-361-4675. We'd love to hear from you. But until then, everyone gets the pleasure of seeing Jean have an endoscopy. Now, before we do this, what is an endoscopy?
Well, technically, an endoscopy just means we're placing some kind of telescope into the body as a mean to see inside the body.
Okay.
So people are familiar with a colonoscopy. That is a form of endoscopy looking at the colon. So in my specialty, we have this little tool, which is a nasal endoscope. And with this, we can look into the nasal cavities, into the sinus passages, into the back of the nose and throat, and I can see things that I can't see with the naked eye, and it helps me to make accurate diagnoses.
So this is a little, if I'm guessing correctly, a little camera right at the end
This
there?
one's not a camera. They
Okay.
do come as a camera. This one's
Okay.
actually fiber optic. So I'm looking in here, and I'm seeing out the tip.
Very cool. Okay, great.
And I can direct it into different areas so that I can see where I'm going.
All right.
And it looks scary because it's black. I always tell patients I wish it was white, but it's not painful. It usually takes about 30 seconds to do, and I encourage my patients not to be worried about it.
Simple, very easy to do.
Right, so just
Can't get
turn
much more
towards-
romantic than this. Live endoscopy on air with your wife. Pretty exciting stuff. Here we go. It's going in. Going in. And I do have to preface, he did numb her nose previously, about an hour ago. So this didn't hurt. All right, there he goes. All the way in. Pretty painless. And you say most people are worried about this, right? And
Yeah, it's scary.
so what are you seeing right now, if it's not too personal a question for Jean here?
Everything looks normal.
All
It's just
right. Oh my goodness, there we go. Live endoscopy on here. What do you think? Was it
bad.
too bad?
Not at all.
Good work, high
you.
five. And I believe we have some pictures. I don't know if someone can grab those pictures for us, but we have some pictures of exactly what he just saw on air. So we'll go ahead and grab those. Very, very exciting. So what is this that we're looking at here?
So this would be if we were actually seeing someone who had a sinus infection. If you look at this picture here, you can see there's a streak of yellow
Okay.
coming down right there, and that would be a trail of pus coming out of a sinus. So
Oh, my.
you can see that it's not too hard to differentiate if there's a sinus infection using the proper tools.
Yes.
So instead of guessing, I can look in somebody's nose and see if there's an actual infection.
Okay,
So
so there
that's
it is.
one of our
That is
tools.
what he just saw, but she has the clear sinuses, so she is good. And I believe we have Carol on the phone. Carol, can you hear me? All right.
Yes.
Well, Carol is not quite
Yes.
coming in clear.
Hello?
Oh, there she is. Hi, Carol. How are you?
I'm fine. How are you?
Great. We're great. We're so glad you could join us today. What's your question for Dr. Marlowe?
Well, the question I have for the doctor is, sinus and adenoids, are they the same thing or two different things? And can your sinuses be removed or can your adenoids? I know you can remove your adenoids.
Okay. That's a good question.
What's the connection between your sinuses and your adenoids?
That's a really good question. The adenoid is kind
Do we
of...
need the sculpture?
yeah, if you bring it up, I'll use it.
Absolutely.
I'm
Here
gonna
we go.
stick this
Whoop.
on you.
There's one part of it. I'll give it to you in pieces. There you
So-
go.
Thank you so much.
Great question, Carol. No
If
problem.
you look at this side of the diagram here, the adenoid sits in this area here, kind of at the back of the throat.
Okay.
It's basically very much like a tonsil. If you remember as talking about children getting surgery, they get tonsils and adenoids. And the reason is they're basically the same tissue. The
Okay.
tonsils are next to the tongue, the adenoids are up here at the top of the throat. And so we can remove adenoids just like we can remove tonsils. You cannot really remove sinuses.
Okay.
What I tell my patients about sinuses is we don't remove them. When we do surgery on them, we're opening them. We're changing their shape maybe. We're cleaning them, altering the access to them, but we're not removing them. The sinuses are really integral cavities in your head. As you can imagine, this is in the middle of your head. I couldn't remove that without you having a major defect in your head. So like if you had a cancer here and we removed it, you would need a plate to block your mouth off from your nose.
Absolutely.
So you don't remove sinuses.
Yeah, no, that would be
Very good question.
That is
Very good
a
question.
good question. All right, well, we have another good question coming at us from Sophie. Sophie, how are you doing? Sophie, are you there?
Yeah, hi.
Oh, hi. How are you?
Oh, good. I can barely hear you.
Okay, well, why don't we? What's your question for Dr. Marlowe?
I have a sinus infection, I think, but my throat seems to be bothering me more, and I don't seem to have any problems with my ears.
Okay.
Okay, so you said you think you have a sinus infection, your throat is bothering you more. Well, certainly if you truly have a true sinus infection, that means that there's bacteria and pus coming out of your sinuses, and if that drains down your throat, that can be very painful for your throat. But there are also many other things that can look like sinus infection that also carry sore throat. For instance, frequently people will have acid reflux that gets up into their throat and nose area, and it will cause them congestion, and it might even cause them bad breath, and it will certainly cause sore throat. And yet it won't really respond to antibiotics the way an infection will. So again, there's multiple things that can look similar, and if your problems are persistent, I recommend you get it checked so you can figure out what you really have.
Great question. Thanks for calling. All right, well, when we come back, we have lots more to talk about. We have things to talk about, what allergies might be and what sinus problems might be. And then we also have Shotzi, the allergy dog. Stay with us. We'll be right back. Welcome back to our final few minutes of Local Doctors on Call. If you have any questions, be sure to call in and get free advice for yourself before it's too late. And the phone number that you need to call is 941-361-4675. So one of the last things we're going to do here is take an allergy quiz. So you're going to be my helper before we get Shotzi to start having allergies for us. Do you think, and so we're going to do this since I'm sure you hear lots as a married couple, I'm sure you hear lots about his job and lots about his sinus patients. So from an average patient standpoint, we'll have you answering these questions. So do you think because you have sinus pain that it's a sinus infection?
Yes.
Yes.
Of course.
Yes. She
Yes.
says yes. She says yes. And doctor, is that accurate?
Actually, it's not accurate.
Okay.
In fact, the statistics are that if 100 people come to me with sinus pain, 80 of those people, it's not going to be their sinuses.
Okay. And so I know when we talk about allergies and sinuses, this here is a plant so if they say, oh, doctor, I'm allergic to plants, I have a sinus problem. Is that true?
No.
No.
Again, what most people think is allergies probably is not allergies.
Okay.
It tends to be an easy thing for people to grasp and an easy thing for people to treat because there's a lot of over-the-counter medicines for it. But what I usually tell people is if you've been treating yourself for allergies and you're not getting better, you might want to start thinking that's not allergies.
Might not be allergies. So this was our example of a dust bunny. This is a pretty vicious looking dust bunny on a pillow here. And then I know some people say they're allergic to animals. And speaking of allergies and animals, we have Shotzi here. Who is this little guy? Is this yours?
Shotzi's our house pet.
All right.
And when we were training him to do simple things like sit and stand, we realized he also knew how to sneeze, and he can do it on command. Shotzi, sneeze, sneeze. Are you going to let me down now?
Oh, his big debut. He's scared.
on,
He's
Shotzi.
nervous.
Sneeze.
Oh, Shotzi, the non-sneezing dog.
He's been
Well, there
sneezing
he
all
is.
day.
He has. I've heard him sneeze about 30 times. Well, maybe we'll get a sneeze out of him. He's nervous. The cameras, the lights, it's all very big, Shotzi. Don't worry. We'll get you to sneeze another time. So one of my other questions here is, do you think, and we'll ask you again,
Yes.
so your yes or no, do you think 3 weeks is too long an amount of time to have sinus discomfort? I know most people will say, what do you think? Most patients would
No.
say, no, 3 weeks, not too bad.
Normal.
What do you think, doctor?
I think it depends. I do have patients that live with headache and face pain all the time, and so they know that's normal for them, if you will. But if you normally don't have headache or face pain and you've had it for more than 2 or 3 weeks, then yes, absolutely that needs attention.
Okay.
People always ask me, when do I need an antibiotic? How do I know when I need an antibiotic? And my guidelines are, if you're having the problem and at the end of a week you're not getting better, the trend is it's either the same or getting worse, that's the time to think that maybe the problem's bacterial, maybe you should get an antibiotic.
Okay. Okay, and let's just tell people, I know we talked a little bit about medicine versus treatment. When do you decide? Where is the breaking point? When do you decide which to approach?
Well, when a patient first comes to me, it depends what's already been done. If they've already had a lot of medical treatment, then the first thing we might be talking about is surgery. But if they haven't had what we would consider excellent or maximum medical therapy, we might want to start with that. So sometimes when I first meet somebody, the first goal is, let's make a diagnosis. So we may do diagnostic things such as a CAT scan, which can be done in the office, or an endoscopy, which can be done in the office. So oftentimes on the first visit, we can get some diagnostic stuff done, get an answer really quick. And then if they have not had maximum medical therapy, we'll initiate whatever medicines we think will cure the problem. And then if that doesn't work, we may have to step back and talk about surgery or in-office procedures.
Okay, another kind of procedure. So we do have somebody on the line right now.
Sure.
Steve, what is your question for Dr. Marlowe?
Hi. Well, I just moved down from Ohio, and I mostly get sinus problems for the winter and the spring, and Florida doesn't really have, that long winter, so am I still going to get the same problems when the pollen comes out?
Will you still have those same problems when the pollen comes out?
Well, Florida's unique in that we never get a freeze, so to speak. So we always have something blooming here. And if for sure your issue is allergies, when you move to a new location, you may seem free of allergies for a period of time because you're not being exposed to the same things you were exposed to elsewhere. But you may eventually develop allergies to your new location. And it also depends on what you're allergic to. For instance, if you're allergic to dust, that's everywhere. So it's not related to location. So people always tell me, I never got sick till I came to Florida, and the joke is that when I ask them when did they come, it was 30 years ago or something like that. But the real answer is, do you really have allergies? That's the question, and should you get tested to see if this is really allergies, or should we be looking at other diagnoses?
For something else. Okay, and thank you for your question. And speaking of allergies, let's give this one last shot.
Shotzi, sneeze, sneeze.
No. Shotzi's not sneezing. No, not today.
I didn't know he was going to be camera
shy. It looks like we are out of time right now, but we will be back in just 1 month to talk about something that you would be surprised has to do with, and that's dizziness, right?
That's correct.
Does dizziness have to do with the sinuses?
Yes and no.
Okay.
Yes and no.
So lots more to learn 1 month from now. So we will leave you with some information in just a second. So now is the time to grab a pen and paper. If you want to get in touch with Dr. Andrew Marlowe, take down his information. It's about to be on the screen in just a second. And I want to thank you again for taking time out of your busy schedule to spend time with us today. We will see you next time so that you can call in live for local doctors on call. No appointment necessary. You stay healthy, Suncoast, because your health is your wealth.